Hello again, welcome back to Advanced Human Gross Anatomy. Today we will be talking about the posterior thigh, as well as the anterior, medial, and posterior portions of the leg. And we'll also finish today with some skeletal review of the foot. Let's start in with the posterior thigh. When we look at the posterior thigh, one of the biggest things we'll see right away is the hamstring musculature. These three muscles make up the bulk of the posterior thigh. Their job collectively is to flex the knee and to extend the hip. We'll see that specifically when we talk about them individually, but they all three have a common insertion at the ischial tuberosity. So that's where you're going to see that their job collectively will be to extend at the hip because they attach to the pelvis, crossing the hip joint. And they all attach down inferior rather, to the knee joint. So two on the medial side, one on the lateral side will come down and attach to the tibia. So their job will be to flex the knee as well. There is one other portion of the hamstring. So this outside musculature portion of the hamstring is called the biceps femoris. It has the long head. Bicep, remember, means two heads in Latin. So the long head comes up and attaches to the ischial tuberosity along with the other two muscles. But there's a short head as well that just attaches to the femur. So this muscle actually is the only muscle of the hamstrings that actually attach to the femur, the short head of the biceps femoris, and therefore it won't have a particular effect on extending the hip, more just flexing the knee. But other than the short head of the biceps femoris, the hamstring muscle group has no attachment to the femur, which is interesting. On the medial side, you'll see here there's the semitendinosus musculature, named for its long tendon right here. Coming down here, you can see it's been cut off. So the one underneath that is the semimembranosus. But these two tendons together come down from the ischial tuberosity and go toward the medial side of the tibia on the front side here. The semitendinosus is often it can be used for ACL reconstructions, taking that tendon as well as maybe the gracilis tendon over here, braiding them together to make up an allograft of the for an ACL reconstruction. And then the biceps femoris is on the lateral side here. So we've talked about this already, that the bicep, meaning two heads, the long head from the ischial tuberosity coming down to the lateral portion, the lateral condyle of the tibia, and the short head coming just from the femur. Here you can see the long head reflected or dissected off, and here's the short head coming down this way from the femur, again, toward that lateral condyle of the tibia. And so the short head will just work to flex the knee, but the rest of the musculature, the long head of the biceps, as well as the semitendinosus and semimembranosus, will all help to flex the knee and extend the hip. When we talk about blood supply to the posterior compartment, or the posterior portion of the thigh, we'll see that it's the deep femoral branch. If I go to this picture, remember we talked about the femoral artery coming down, and then one of these first branches off here called the profunda femoris, or the deep femoral artery coming down. That's going to supply the posterior portion of the thigh itself. If we go back to this picture, next you'll see the sciatic nerve. This will become very apparent and very clear in today's dissection. It's about the thickness of your one of your fingers, maybe your little finger. It's a huge nerve. It'd be very obvious to see. It will go right in between, underneath the piriformis, and go in between this lateral hamstring muscle of the biceps femoris and the medial muscles here of the semimembranosus and semitendinosus. Here you can see the Netter has drawn in a hook here to kind of pull that semitendinosus away, but just to be able to see the semimembranosus. But that sciatic nerve will follow right down in between those two compartments there, between the lateral and the medial hamstrings. And you can take a gloved hand in the dissection and kind of separate these muscles to try to find that, to trace that sciatic nerve down the posterior thigh. It will split just proximal to the popliteal fossa here, which we'll talk about later, what happens when it splits there. But the popliteal fossa this portion on the posterior portion of the thigh. You can see where the hamstrings come down on the medial aspect here, and the hamstring comes down on the lateral aspect here. And then from inferiorly, the gastrocnemius muscle that we'll talk about in just a little bit comes above the knee joint, attaching to the medial and lateral femoral condyles. So the hamstrings attaching to the medial and lateral tibial condyles, and the gastrocnemius attaching to the medial and lateral femoral condyles. They kind of make up this sling here. The space in between is just more of a membranous fascia that will kind of cover that space between. We call it the popliteal fossa. So superior to the gastrocnemius, inferior and kind of medial to the hamstring insertions down here is that popliteal fossa. The popliteal artery, you can see here, remember that was a continuation of the femoral artery as it pierces that adductor magnus muscle and comes and just continues on into the popliteal fossa and becomes the popliteal artery. So you can see that. Here you can start to see too that the sciatic nerve will split. Maybe there's a better view of this here, where the popliteal fossa, again, popliteal artery, popliteal vein coming up into that adductor magnus and then joining in with the femoral vein, draining the leg. But here you can see this, the split of the sciatic nerve here. So the sciatic nerve comes straight down. It will form two nerves here. Well, let me go back to this one. It'll form two branches here. One will be the common fibular. This is an older book. Here you can see Netter's drawn this as the common peroneal. That's another common name for it, but we're trying to get away from peroneal. It sounds too much like perineal, I think. So common fibular nerve will branch off of here. And then the other branch continues down, is called the tibial nerve. The tibial nerve continues down into the back of the calf musculature here, and then the common fibular travels down more the lateral side of the knee. The common fibular then will split into a couple other branches, the deep fibular nerve, which will go down into the anterior portion of the leg, which we'll see in a little bit, and the superficial branch, which continues down into the lateral compartment of the leg. Again, we'll talk about those before, but in a little later. But you'll see how it's kind of all housed into one sheath up into here. Up into the gluteal region, but all of these branches, the tibial and the common fibular, are all kind of separated. They split just proximal to the popliteal fossa, but they've already decided where they're going, way up into the gluteal region here. Even though they're wrapped in the same fascia, it looks like one big nerve here, but they do separate even up higher into the gluteal region. Here you can see the posterior femoral cutaneous nerve, again coming off of the sciatic nerve, giving branches for superficial innervation to the back of the thigh coming down this way. If we look at some musculature now on the back of the leg, posterior leg, you'll see the first muscle out here is the gastrocnemius. This is a big kind of heart-shaped muscle when you stand up on your tiptoes or walk up a flight of stairs, pushing off, plantar flexing your foot. This is what's going to pop out here, the most superficial one. It actually spans two joints. It's going to have its origin on the medial and lateral side of the condyles of the femur, of the posterior femur, and then insert down into the calcaneus, the posterior calcaneus, together with tendons of the soleus muscle, which we'll see in a little bit, which is deep to this, as well as a funny muscle called the plantaris. Those will come down and have a common insertion down here at the calcaneus into the Achilles tendon, or calcaneal tendon as it's often called, or tendocalcaneus, a few different names for that insertion down here at the calcaneus. But the gastrocnemius is interesting because it never touches the tibia or the fibula. It just kind of courses over. So from the femur, crossing the knee, so it's going to help flex the knee, but then it courses over towards the calcaneus. You're never even touching the distal tibia or fibula here. So it's going to plantar flex the foot and help to flex the knee as well. You can see there's more kind of white muscle fiber than in the soleus muscle here. If we take this away, the next muscle down, you can see more red muscle here on the soleus, which really does make up kind of the majority of the mass of the calf. So you can see the gastroc has been cut here where its insertions were on the medial side and the lateral side here. Underneath the gastrocnemius is the soleus. Has its origin from the medial tibia and posterior fibula over here on the back side below the knee, so it does not cross the knee joint, and inserts again with that common insertion down at the posterior calcaneus here. But in all the donors that I've seen, this is always a much bigger muscle mass than the gastrocnemius. So when people look at the calf, they think, oh, this gastroc, that's really the big muscle part of it here. I think what you'll notice in lab is that really the bulk of the calf musculature is the soleus, which is just deep to that. Now another muscle in here, this funny one called the plantaris, which is actually is kind of an odd muscle, but it has its origin off the posterior lateral portion of the femoral condyle, and it sends this long, the muscle is actually really quite short, and then it sends this long tendon traveling down between the gastroc and the soleus. Students will often ask, when I've seen this before, they'll come in and they'll say, what's this nerve that's going between the gastroc and the soleus here? And that's really just the tendon of the plantaris. That will come down as well and attach into the posterior calcaneus in that calcaneal tendon to have that common insertion with the soleus and the gastrocnemius. It has a dual function. Again, it crosses two joints. It's going to help flex the knee, and because it attaches to the posterior calcaneus, will help to plantar flex the ankle as well. And there's another odd muscle back here called the popliteus, or popliteus. I always call it the popliteus. But the popliteus here is kind of an oddity as well. It comes from the posterior lateral femoral condyle and some kind of the horn of the posterior, the lateral meniscus. And goes down it travels diagonally towards the medial tibia down here. And you think, well, what does that do? People think that the main job of the popliteus is to unlock the knee, kind of help unlock it as you initiate walking. After you've stood on a kind of a straight locked knee, this will help to kind of unlock the knee to initiate the bend as you start to walk. So that's the popliteus here. Now, blood supply. Let's talk about some blood supply to the posterior. To the knee. I think this is probably the best shot for the knee too. So again, the popliteal artery coming down here into the popliteal fossa. It'll have these genicular arteries here that come laterally off of that. There's a superior medial and lateral genicular artery. There's an inferior medial and lateral genicular artery. Genu means bend. So thinking of the knee, how it's named. And these are going to be obvious in the popliteal fossa near where the knee joint line would be. So you'll see the superior and inferior medial and lateral genicular arteries off of the popliteal artery here. Okay, let's talk a little bit about some bony anatomy of the leg. The tibia. Here, this big bone called the tibia on the front of the leg, and then lateral to that will be the fibula. So this is the right tibia and right fibula from an anterior view and a posterior view. A couple things to be mindful of here: the lateral and medial tibial condyles. This is going to articulate with the medial and lateral femoral condyles as the femur sits on top here. Note that the fibula here on the outside doesn't actually articulate with the femur at all. So the only thing connecting to the femur is the tibia. The fibula just acts more like a support underneath the lateral tibial condyle out here. The tibial tuberosity we talked about with the quadricep attachment. That's kind of what people will often associate as the quadricep attachment. Though the quadriceps have a broad attachment across the anterior tibia, they do also attach that bump on the front of the tibia, the tibial tuberosity. And then the medial malleolus here on the outside of the knee this way. Now this is the outside. I'm sorry, the inside of the ankle. This is the medial aspect of the ankle bone. So when you kind of right above the shoe, if you were to reach down and kind of feel that medial bump on the inside of your ankle, that's the end of the tibia called the medial malleolus is out there. On the fibula, a couple things here. Fibula actually means flute. That's what that word means. I don't know if the Greeks actually made flutes out of these things or if they just looked like flutes. I don't know. But the head is proximal. That's going to be with that bump on the outside of the leg, just distal to the joint line, underneath the lateral femoral tibial condyle. Here is the head of the fibula on the outside, and then you got the shaft coming down here. And then at the distal aspect of the fibula is the lateral malleolus. So you've got the medial malleolus and the lateral malleolus. This is that inside, the inside ankle bone here and the outside ankle bone here. So when you look, people call them ankle bones. I shouldn't say that at all. This is a proper anatomy class. Let's not call them ankle bones. The ankle is a joint, not a bone. So that bump on the inside is going to be the medial malleolus, the end of your tibia. The bump on the outside is going to be the lateral malleolus, the end of your fibula. That makes up that. Now, if we look at the compartment of the leg has three basic compartments to it. Here you can see a left tibia kind of cross-sectioned here, looking straight down. Well, we've talked about CT scans from feet up, so we'll call this the right leg here. I apologize. So the tibia here, the fibula on the outside. Here's this anterior compartment. Here's a lateral compartment, and then the posterior compartment actually has two. There's a superficial and a deep posterior compartment. Now the musculatures the muscles that we're going to talk about here. Here's that front compartment, the anterior compartment. So the tibialis anterior right here, the extensor digitorum longus right here, and the the extensor hallucis longus right here. We'll talk about those particular muscles in a little bit. I learned this as Tom, Dick, and Harry. Just three names here, Tom, Dick, and Harry from an old children's book. So you can see that. The lateral compartment, you'll see here is the fibularis longus and the fibularis brevis. That makes up the lateral compartment right here. And the posterior compartment has another Tom, Dick, and Harry in the deep compartment, the tibialis posterior, right here, T, Tom, the flexor digitorum longus right here. There's Tom, Dick, and then Harry is right here, the flexor hallucis longus. I don't know if that helps you or hurts you to think about it that way, but the anterior compartment and the posterior compartment, they look very similar. They both have a tibialis anterior, posterior. They both have an extensor digitorum. This has a flexor digitorum. And then they both have have a hallucis, an extensor hallucis longus and a flexor hallucis longus. So we'll be able to kind of see that as we get going. And then the superficial compartment we've talked about as the soleus. Look at the mass of the soleus here. Here you can see that little plantaris tendon sneaking through, and the medial and lateral heads of the gastrocnemius here. So you can see the medial and lateral head that way. So that is the three compartments. Let's talk more specifically now about the anterior compartment. The tibialis anterior is a muscle here. Well, first let's maybe talk about the innervation. Innervation is from the common fibular nerve. Remember that the sciatic nerve splits here above the kind of just superiorly to the popliteal fossa, and it will come down into the common fibular nerve, kind of from the lateral aspect of the knee coming around this way, as it kind of rounds that lateral condyle of the tibia and the fibular head, and then splits. Here you can see how it's going to split into a deep portion, which is actually going to come down and supply more of the anterior leg, the branch from the common fibular nerve. And then there's going to be a superficial branch here that comes down and supplies the lateral compartment of the leg here. So we'll talk about the anterior compartment being the deep branch of the common fibular nerve is where it gets its innervation from. Okay. The tibialis anterior comes from the anterior tibia and fibula right here, as well as the interosseous membrane between the tibia and the fibula. And it inserts down here. You'll see it come across the front of the foot, and it inserts on the top of the first cuneiform and the first metatarsal of the foot here. So its function will be mainly to dorsiflex the foot, and a little bit, because it attaches to the medial aspect of the foot here on the first cuneiform and first metatarsal, it will be to invert a little bit. So it's going to be a dorsiflexor and an inverter of the ankle. Okay. The extensor hallucis longus, if you follow that tendon straight from the big toe has got its own flexor. I'm sorry, extensor, flexor too, but we're talking about the extensors. The extensor hallucis longus right here is going to come up more from the fibula here, coming down across the foot, and then extending onto the great toe to help extend the great toe. And then the extensor digitorum longus right here is going to be this musculature here that comes down and then splits. You're going to notice how this is going to come down on the front of the foot and then split into all these tendons here to go to the rest of the toes. And so it's a muscle with long tendons here to the second, third, fourth, and fifth toes. But it actually has 5 separations here. Let me find a different picture. Let's go to this one here. So tibialis anterior, coming down here into the first cuneiform and the first metatarsal. Flexor, the extensor hallucis longus right here, coming down onto the great toe to the distal phalanx of the great toe, and then the extensor digitorum longus coming down. And here you can see it splits into the second toe, into the third toe, the fourth, and the fifth. Has these tendons that come down. But you're counting here and you say, wait, there's 5. Why is there this little, this extra tendon that seems to be sneaking off of the extensor digitorum longus? And it attaches to that 5th toe as well, twice. Once down here onto the distal phalanx, but also down kind of onto that metatarsal as well. This is kind of referred to as, here you can see it even labeled by Nitter as the fibularis tertius, this kind of oddity here. Some anatomists will just say it's part of the extensor sheath, the extensor digitorum, it comes this way, but it actually, some will kind of say, no, it's this renegade muscle that kind of attaches, it's part of the lateral compartment that comes over to the, near that fibularis brevis attachment on the outside, but it really does kind of contain all into the extensor. It kind of comes up into that common extensor digitorum longus fascia bundle here that comes up into the muscle. So you'll kind of see that there's this 5th little ray coming off towards that 5th metatarsal. Just an interesting anatomical structure there. Blood supply to the anterior leg here. Let's go back here. You'll see the blood supply. Remember, the popliteal artery will split into the anterior and posterior tibial arteries. Anterior coming in front, that's what's going to supply the anterior compartment, and the posterior tibia will go behind. It will just continue down into the posterior aspect. You can see how the anterior tibial kind of pierces through that interosseous membrane. To go to the front, the posterior tibia will just continue down on the posterior side of the leg. The anterior tibial will also come down and give branch on the dorsum of the foot. You can trace it down here, and it's going to come down this way. I think I've got a better shot of it here as it continues. And it will kind of split in between the first and second metatarsals, between the first 2 metatarsals here, and this is a common. This is called the dorsal pedal, the dorsal pedis artery on the dorsum of the foot here, and it's often a place most commonly used by physicians to help diagnose a peripheral circulation issue. So if you kind of put your thumb, a physician will put their thumb underneath the arch of the foot, and there are a couple of fingers on the top here to kind of palpate that dorsal pedis artery to see if there's a good pulse there. So if you have a strong pulse in this artery, that's good. You've got no peripheral artery issues there, so that's helpful. A couple other things in this picture here. You'll see the retinaculum. This retinaculum is this fascia, this connective tissue that covers. Here's a superior extensor retinaculum and an inferior extensor retinaculum. And these kind of come down to help keep those tendons tight to the foot and the ankle as they course down here. What you want to prevent these tendons from bowstringing. Imagine stringing a bow kind of spanning between two ends of the bow. That's what you don't want that to be from the tibia down to the toes. You want it to kind of course down and hold tight to the ankles. That's what these retinaculum are for, the superior and inferior extensor retinaculum. Okay, let's move on to the lateral compartment. Here's the lateral compartment. So the two big muscles here, the common, remember that the common fibular nerve will split into the deep fibular, let's go back to this one. So we'll split the common fibular nerve here. Remember, it comes down this way and splits into the deep fibular branch here. That supplies the anterior compartment. But then it splits here into the superficial branch here, the superficial fibular nerve coming down this way. That's what's going to give the supply to the innervation to the lateral compartment. The musculature that we'll talk about here, the fibularis longus, coming from the head of the fibula here, coming down on the lateral side of the leg. It originates up on the fibular head, comes down as it kind of courses behind the lateral malleolus here, the end of so from the head of the fibula courses behind the distal end of the fibula. The distal portion is that lateral malleolus, comes around here, hooks around, and then actually attaches to the bottom, courses underneath the foot and attaches to the inferior aspect of the first cuneiform and the first metatarsal. Remember, the tibialis anterior comes down on the top portion of those two bones. On the tibialis, the tibialis anterior will attach the top superior portion of the first cuneiform and the first metatarsal. Well, the fibularis longus comes around underneath and attaches to the bottom side of that. So they're going to be kind of acting against each other. This is going to do the opposite action as the tibialis anterior. It's going to plantar flex the foot and then help to evert the foot slightly as it comes out to the side. Underneath that, I don't know if I've got a good picture of the fibularis brevis. I guess I don't. But underneath the fibularis longus is the fibularis brevis, which comes down kind of on the mid shaft of the fibula underneath. You can see it kind of sneaking through here. Here's that tendon underneath as well, traveling with the fibularis longus coming underneath. But this one just goes right to the base of the fifth metatarsal, right here, right to the head, the base of the fifth metatarsal here. So that's going to be mostly for eversion of the foot. So plantar flexion and eversion is the fibularis longus, and then the fibularis brevis would be the more just eversion of the foot, coming that way. And then you can see here there's a couple different more retinaculums here. There's this superior and inferior fibular or peroneal retinaculum here. You can see kind of holding the fibularis, or they used to call these peroneals. Again, you can see we're getting away from that name. The fibularis longus or the peroneus longus and fibularis brevis used to be called peroneus brevis, but that will attach down here to kind of keep them in line and in place that way. And then if we look at the blood supply, now what's interesting about the lateral compartment is that it doesn't have its own blood supply. It doesn't have its own artery that comes down to supply the lateral compartment. It has its own nerve, the superficial branch of the common fibular nerve, but it doesn't have its own artery. It gets its nutrition from the posterior tibial artery along with into the posterior compartment. So it'll share some nutrition with the posterior compartment, which we'll see in just a little bit here. Now the posterior compartment, if we look back at the musculature here, the gastrocnemius is the most superficial portion here. We've already talked about the musculature, but again, the gastrocnemius, unique because it never touches the tibia or the fibula, it just courses from the posterior femoral condyles down to the posterior calcaneus this way. Again, a dual function of the gastrocnemius, flexes the knee and plantar flexes the foot. So needed for walking, and you think, well, that's kind of an interesting thing, but walking is kind of an important function. When you bend the knee, you also need to point the toe. So you'll notice that when you're taking a step, you need them both at the same time. So the gastroc is really important for those kinds of functions. Again, originates from the medial and lateral femoral condyles, inserts down at the tendocalcaneus or the calcaneal tendon down here. Remember that the soleus and the plantaris also attach down at that same insertion here. Again, if we take that away and look at the soleus and the plantaris coming down, the plantaris will cross the both joints as well, but the soleus doesn't. It just crosses the ankle joint down here. So it comes below the knee joint from the posterior portion of the tibia down to the calcaneal tendon here. And popliteus, remember this funny muscle here from the femoral condyle to the medial tibia down here, coming this way, kind of helping to unlock that knee. So again, there's little muscle activity with standing with a locked knee. And so to initiate that breaking of that locked knee, you're going to activate that popliteus to initiate that bend of the knee as you start to move. So that's there. The blood supply to the back of the thigh, or back of the posterior compartment of the leg. If you remember here, here's that popliteal artery, splits into the anterior artery. You can see going through anterior tibial artery, which goes through that interosseous membrane here. And then it continues, the popliteal continues down into the posterior compartment. And so here between the superficial and the deep layers, you can see we've gotten rid of the gastrocnemius. Here's the kind of the cut of the soleus. So that superficial compartment, now we're looking at the deep compartment of the leg, but that will be between there. So the posterior tibial artery will be between the superficial compartment, the musculature, and the deep musculature of the posterior compartment. That posterior tibial nerve or artery. So, and then the nerve here, the tibial nerve, remember the sciatic nerve came down and it split around the lateral aspect here to the common fibular, and then it continued down into the tibial nerve. Now that is also going to travel with the posterior tibial artery, the tibial nerve here, and come down and supply that posterior compartment. So it's going to give both superficial and deep compartments of the leg. It's going to supply that innervation there. And it will continue down onto the bottom of the foot and branch into the medial and lateral plantar nerves. And then go posterior, as a kind of posterior here to the medial malleolus. You can see where it comes down posterior to that and then branches into the medial and lateral plantar nerves as well on the bottom of the foot. The popliteal artery we talked about comes down. I talked about this already, coming down. Popliteal artery splits into the anterior tibial and the posterior tibial artery. Coming here. Here you can also see the split after it turns into the posterior tibial artery that just continues down the back of the leg. Sometimes you'll see this. It's sometimes difficult to find. It can be pretty small, but there's this fibular nerve or the fibular artery or the peroneal artery. And you think, oh, the fibular artery, that must supply the lateral compartment. It doesn't. It continues. It supplies the posterior compartment as well. So it's got a funny name to it. By the name of it, it sounds like it should be supplying the lateral compartment, but it doesn't. Along with fibularis brevis and longus, but it's just in the back side of the posterior compartment here. So posterior tibial will split into fibular artery, but that still just all supplies the posterior compartment with nutrition. Okay. Let's see what else we want to talk about here. Now, the musculature, probably just keep it on this picture. So the superficial compartment of the posterior compartment is, superficial muscles are kind of dissected off. Now we're looking at the deep musculature of the posterior compartment. And this is a little bit funny here because you've got the tibialis posterior, which sits right in midline. This is going to originate from the posterior tibia, and then come down and insert onto the bottom of the foot here, onto the navicular, the cuboid, the three cuneiform bones, the base of the metatarsals 2, 3, and 4. It has a broad insertion down here. The tibialis posterior comes down to the bottom of the foot. Okay, and then you've got the flexor digitorum longus on the outside right here. Flexor digitorum longus is more lateral here, and that is going, I'm sorry, more medial. That's good. So, and the midline is going to be tibialis posterior. More medially is going to be the flexor digitorum longus, and that's going to come from the posterior tibia as well, and then come down posterior to the medial malleolus, and then attached to the base of the distal phalanges of 2, 3, and 4, digits 2, 3, and 4 down here. So it's going to help flex the toes. Remember, the extensor digitorum was on the anterior side. The flexor digitorum is going to be on the back side, coming down here. And then the flexor hallucis longus is out here. This is more lateral on the leg, but it's going to come from the posterior fibula outside here, and then it's actually going to just trace around again along with the other the other two tendons here. It's going to come on the medial, posterior to the medial malleolus, and then attach down onto the base of the distal phalanx of the first digit on the hallux here. So it's going to be the flexor hallucis longus, just to the big toe. So just like we had on the anterior side, the extensor digitorum is going to go to the other 4 toes. The flexor digitorum is going to go towards the other 4 toes. The flexor hallucis longus is just going to go to the big toe to flex it, just like the extensor hallucis longus went to the big toe to extend it. So similar there. Now, what's unique about this posterior compartment, though, is when you identify the musculature, I said that the tibialis posterior is medial here, and then the digitorum longus, flexor digitorum longus, and flexor hallucis longus would be, digitorum would be medial, hallucis would be lateral. So, but then they split here, they switch here. The tibialis posterior is the first one down here. It kind of sneaks underneath digitorum longus here. So tibialis posterior, flexor digitorum longus, and then flexor hallucis longus is on the outside here. So it kind of sneaks around. The order changes as it goes posterior to the medial malleolus here. So when I learned this, it was down the hatch. Flexor digitorum longus, tibialis posterior, down the T, and then hatch, flexor hallucis longus. And then here's Tom, Dick, and Harry again. So Tom, tibialis posterior, Dick, extensor digitorum, flexor digitorum longus. And the A is actually the posterior tibial artery here, and the tibial nerve coming down this way, and then the Harry is the flexor hallucis longus. So that order switches. So down the hatch turns into Tom, Dick, and Harry. Again, posterior to the medial malleolus. So you can see that. Hopefully that wasn't too confusing. Let's just finish up real quick with some skeleton of the foot, shall we? The talus bone here, if we look at a side view first here, the talus is articulates with the distal end of the tibia and the fibula. Here you can see the medial side would be the tibia. Here the medial malleolus sits here. The lateral malleolus sits on the outside here, where it would articulate with the distal end of the tibia and the fibula. I think of it as, it's not the tallest bone, but it's when you look at it on the foot, it's the tallest here. So the talus is the tallest. I don't know if that's helpful for you to remember or not, but the talus is up on top. And about 50% of your weight, as you push through the talus, about 50% of the weight is going to go directly posterior or inferior to that into the calcaneus. So that's going to hold about half of your body weight, this bone just underneath the talus. 50% then is going to go towards the anterior aspect down in through here to the anterior portion of the foot. So when you get out of a pool or a hot tub or got the shower and you got a wet footprint, you'll see that the heel will be a big portion here. That's about half your body weight going down through here. The arch should be maintained a bit, and then you're going to get a lot of the weight here. You'll see the heads of the metatarsals, the ball of your feet kind of pushing up on here onto the ground, and then you'll end with the digits on the toes, the ends of the toes there. So heel, ball of the foot at the metatarsal heads, and then the toes. So that's going to be kind of that the arch being in between the heel and the metatarsals here. Now the next bone here, the cuboid, sitting right in front of the calcaneus on the lateral side. Greeks thought that looked like a cube. It's cube shaped, so they named it the cuboid. it articulates anteriorly. If I go back to this view, it articulates anteriorly with the fourth and fifth metatarsals. So anterior to calcaneus is the cuboid. Anterior to cuboid would be the fourth and the fifth metatarsals here. The navicular bone on the medial aspect of the foot, you can see the talus, calcaneus, and then here is navicular. On the lateral side, you've got the cuboid. On the medial side, you've got navicular. Now, this is going to be kind of at the arch of the foot. You'll see that the arch of the foot is taller on the medial side than the lateral side. And that's because of this navicular here. Inserts from the talus in front of the talus. Greeks thought that must have thought that looked like a boat because it's got the root word, the same root we use for navy. Looks like a boat is what that means. Navicular. So the top of the arch, the most proximal portion of the arch. Often in running, if you're a runner, sometimes you'll have patients that will come in with pain from running right in this portion, this proximal portion of the arch. Sometimes there's a strain or a sprain to this talonavicular ligament that can cause pain with loading through that proximal portion of the arch there. The cuneiforms, these three bones here, anytime in anatomy when you have the suffix iform, that means literally having the shape of. And then cunea in Latin means wedge. So the shape of having the shape of a wedge is kind of what they thought this looked like here. So these three bones here in front of the navicular are going to be the cuneiforms. There's a medial cuneiform here. There's an intermediate cuneiform right in the middle, and then a lateral cuneiform as you go from medial to lateral. It's often sometimes noted as 1, 2, and 3, the first, second, and third cuneiforms if you're going from medial to lateral again. But they articulate with the first metatarsal, the second metatarsal, and the third metatarsal here. So you should be able to kind of identify that. So remember that the cuboid articulates with the fourth and fifth metatarsals, and the first, second, and third cuneiform articulate with the first, second, and third metatarsals, respectively. And this is more like the middle of the arch. If we go back to this picture, you'll see the cuneiforms here. So the middle of that arch here. And then the metatarsals, you see at the ends of all that, the first, second, third, fourth, and fifth metatarsals here. This is going to be the distal portion of the arch, numbered medial to lateral, 1 through 5, just like that. And at the ends of the metatarsals here, you've got the phalanges. First, second, third, fourth, and fifth, the toes you would call these, the phalanges here. The great toe just has a proximal and distal phalanx, are just the particular bones within the phalange. The phalange is the toe itself, the digit, but then the phalanx is just this individual bone. Each individual bone is a phalanx here. So the great toe has a proximal and a distal phalanx. The other four have proximal, middle, and distal phalanxes here to make up the phalanges. And that's it. I hope that was helpful. I hope you learned something, and I will look forward to seeing you in lab. Thanks for your time.